Having a weak erection is supposed to be something that is normal because of some factors that might affect the man at that particular point in time. But weak erection or erectile dysfunction becomes a problem when it is frequent. Hello guys, good day and welcome to my channel if you're here for the first time, and welcome back to my OGs. You guys are the best. Thank you for always coming back and watching my videos. So in today's video, we're talking about erectile dysfunction or weak erection, and we're going to be knowing the causes of weak erection, and we're going to also find out some drug-free treatment options that a man that is passing through this situation can undergo to help himself alleviate the symptoms. Erectile dysfunction is a condition where a man is unable to achieve or maintain an erection that is firm enough for sexual intercourse. This weak erection or erectile dysfunction can be as a result of an underlying condition, like there is a problem going on with the man or something, a condition that the man is passing through that brought about this weak erection. And most of the times when this underlying condition has been treated, it can reverse this erectile dysfunction. So most times having weak erection is not possibly like there's something wrong with your reproductive system. Sometimes it can be psychological, sometimes it can be physical conditions that brings about this weak erection. And when this underlying condition is treated, the man can get himself back. Some common symptoms of erectile dysfunction or weak erection includes reduced sexual desire, trouble getting erection, and then trouble maintaining erection when the person does not want anything to do with the opposite sex, or you see a woman, even if the woman is naked in your presence, you don't even feel anything, you don't feel aroused. And then when another symptom is when you feel the erection, you cannot maintain it to be able to bring about the sexual desire that you want. The causes of erectile dysfunction can be in two parts because a combination of two factors brings about this erectile dysfunction. We have the psychological factors and the physical factors. When you say physical factors, you mean those factors that can affect your health as a person, like maybe your blood system, your reproductive system, your body. That is what physical factors are. And some of these physical factors include heart diseases. Heart diseases brings about reduced blood flow to the body, and erectile dysfunction is mainly a case of reduced blood flow to the penis, because what causes erection is when enough blood flows to your penis. So heart disease is one physical factor that can make a man have erectile dysfunction. Then we have atherosclerosis. This is when the blood vessels are clogged and there is inability of blood flow around the body. Excess cholesterol in a man's blood can cause erectile dysfunction. Obesity is associated with erectile dysfunction, and then diabetes can also be associated with erectile dysfunction. Hormonal imbalance in a man, especially low testosterone level, can cause erectile dysfunction. Surgeries and other traumas that affect the pelvic region of a man and also the spinal cord can bring about erectile dysfunction. Another cause of erectile dysfunction is substance abuse. Men that smoke, excessive intake of tobacco and alcoholism can make a man have erectile dysfunction. So all these physical factors I just mentioned, to mention a few of them, these are some physical factors that can cause erectile dysfunction in a man. And then the psychological factors of erectile dysfunction includes depression, anxiety, and other stressors. Depression, low self-confidence and low self-esteem, like you belittle yourself, thinking maybe because of a failed relationship, you think that you're no longer good enough to give love or receive love. Other mental conditions, anxiety and chronic stress are psychological factors that can make a man have erectile dysfunction. All these psychological factors that I just mentioned can trigger imbalanced chemicals in your brain. Consider that sexual urges start from a person's brain, and successful sexual intercourse has a combination of both the psychological factors and the physical factors. So when one of these factors is absent, or when one of these factors is unstable, it can lead to erectile dysfunction or weak erection, inability to maintain your erection to achieve sexual desire. Now, here are some of the drug-free treatments that I researched and want to share with you for people that might be undergoing this condition. And also, I want to advise that you should not be shy to speak up your mind. Some men are so shy that they cannot even talk to their healthcare provider to tell them their problems. You need to speak to somebody so that the case will not get worse. Now, dysfunction. One of it is the Kegel exercise. Kegel exercise is an exercise that involves contracting your pelvic muscles. For example, when you feel the urge to pee and there is no convenience to, ease yourself, you tend to contract your muscles so that you can hold the urine until you find a place to ease yourself. That is what Kegel exercise looks like because we know that exercise brings about normal blood circulation. So Kegel exercise is one drug-free treatment option that a man that is experiencing weak erection can use to alleviate his symptoms. Drinking enough water every day is one other drug-free treatment option that a person, even whether you're sick or not, you should be drinking enough water, because when you have a lot of water in your body, it will help your blood to circulate properly, and staying hydrated also improves blood flow to your penis. So this is one of the drug-free treatment that I have here for erectile dysfunction. Replace your alcohol, your tobacco with fruits and vegetables. Fruits and vegetables has vitamins and minerals that can improve our body system and help us alleviate whatever underlying disease that might be causing erectile dysfunction, if it is that minor. So eating a lot of fruits and vegetables can also improve symptoms of erectile dysfunction. Rumor has it that men that exercise last longer in bed. So regular exercise, as in general body exercise, is one other treatment option that I have here for erectile dysfunction, because people that exercise are always fit. Exercise improves blood flow to the general body as a whole. It improves blood circulation, unlike the Kegel exercise that is specifically for your pelvic region. Men that exercise are always they appear very healthy, they appear cheerful, they appear very fit. So exercising your general body and not staying dormant at a place improves your symptoms of erectile dysfunction. Like I earlier mentioned about low self-confidence, this particular word, low self-confidence, can bring about erectile dysfunction. It can make a man feel that he is incapable of satisfying his partner. This low self-confidence can be from external factors, what someone else has told him, past experiences. So learn to control your emotion as a man. Show up as a king that you are. Do not allow anybody to belittle you. Always be cheerful with yourself. Tell yourself that you are capable of doing whatever you choose to do. Be satisfied with whatever the size of penis that God has given to you, because a lot of people complain that their penis is small and they begin to take several things that does not even work at all to increase the size of the penis. And when this happens, maybe because a lady had told them before that the size of their penis is little and cannot satisfy her, they begin to feel so low about themselves. So learn to control your emotion as a man. Do not allow what someone else said to affect you. Reduce stress or avoid whatever makes you feel stressed and weak at every certain point in time. Also, set realistic goals for yourself. Do not set goals that are unachievable at a time frame that you have set for yourself, and then you begin to feel stressed out and feel like you're not doing enough as a person, because this thing can affect you mentally. And when your mental health is affected, it can invariably affect your physical health as well, which can cause erectile dysfunction for you. And another thing that is very important is that you should speak to healthcare professionals. Emphasis on the professionals, because a lot of persons do not even go to the hospital. They just see adverts on social media on concussions that can help with erection or increasing the size of your penis, and then you go ahead to buy them when they are not even doing anything for you, and you don't even know the mixture that is in there. So always speak to healthcare professionals, because these people are capable to run tests that suits your condition, and they can be able to fish out what is the main cause of your erectile dysfunction. Don't be shy. Talk to professionals that can help you, because Mr. A can claim that the concoction that he drank worked for him, and Mr. B will go and take it. It will not work, because the underlying cause of Mr. A's erectile dysfunction might not be the underlying cause of Mr. B's erectile dysfunction. So be very careful what you take to treat yourself. Be very careful of over-the-counter drugs that you take to treat your erectile dysfunction. That is why I always advise my viewers to speak to healthcare professionals, so that you don't make your symptoms worse. In our next video, we'll talk about premature ejaculation and ways that it can be managed. So if this sounds like what you want to watch, I hope to see you next Tuesday. If you watched my video till this moment and you have not subscribed, I don't know why you haven't subscribed. Please kindly subscribe to my channel. Share this video so that it can, get to people that need to hear this particular information that I shared here in the video. Like the video to help it get to many other viewers who the information can be helpful to. And I'll see you next Tuesday. Thank you so much for watching. Bye.